Right, just a minute after the half hour, so I'm going to go ahead and get started with our introduction and then pass it over to our presenter today. So welcome everyone for joining us today to talk about a topic that is very important but often overlooked, which is primary care and prevention. My name is Marissa Frieder. I'm the Assistant Director of Programming for WorkWell NYC. Today we have with us Dr. David Stevens, who's the Chief of Ambulatory Care at Health and Hospitals Kings County.
Hello.
And before I turn it over to Dr. Stevens, I just want to give a little overview of WorkWell NYC and who we are, in case we have any new folks joining us today. Bear with the slide. So WorkWell NYC is the city's workplace wellness program, and we have 4 program buckets that we operate within. So we have physical activity programming, we have daily fitness classes that are happening virtually, we have step challenges, a variety of activities to help you move more. We also do a lot of work around healthy eating. We have cooking demos, actually we have one scheduled tonight. We partner with Weight Watchers and do a range of other activities to help support healthy eating and healthy lifestyle. Our Take Action bucket is all about this very topic, primary care and prevention. We offer free flu shots, health screenings in the workplace when the workplace is a safe place to be, gathering all together, and a range of other activities. And lastly, we have our mental health component, Be Well, which is all about helping us build mental well-being and resilience, which is more important than ever these days. So next slide. And so today, as I mentioned, we're going to be talking about primary care. And I know I'll just say from my own experience, I think primary care is something that is often overlooked or neglected. I'm lucky enough to be pretty healthy. I've always had a primary care provider. Recently, I had one. I went to the office for 3 years. I think I never actually met the provider. It was always someone else, you know, a student, a nurse practitioner, whatever. But about a year ago, I found a primary care provider who truly became my partner in managing all of my health issues. And it was really life-changing for me. And I hope that today's presentation can help us all kind of get on that path to finding a person who can truly be a partner in your health. So today we're going to talk about what is a primary care provider, why do you need one, what they can do for you, how they can help your overall health, and how to find a provider that's right for you. And after Dr. Stevens speaks, I'll share some tools that WorkWell NYC has to kind of help you find that person. But for now, I'm very pleased and honored to be able to hand it over to Dr. David Stevens.
Hi, good afternoon. Thank you, Marissa. The theme that Marissa brought up that I want to kind of continue is this idea of partner in health. That's what primary care is about. And so we're going to spend a few minutes talking about kind of what is primary care, who are primary care providers. We're going to talk a little bit about primary care in the age of COVID surges, because I think that's really important. And then we'll take some time for questions. So who is a primary care provider? And a primary care provider is a professional. It's either a physician, a doctor, it could be a nurse practitioner or a physician assistant. These are all trained, licensed providers who can diagnose, prescribe, do the full scope of what is needed for helping you keep healthy. But we focus on it, I think, from 4 different perspectives. One is prevention. What can we do today to keep you healthy down the road? Controlling chronic illnesses. How do we keep you, if you have a chronic illness, how do we minimize its impact on your life, keep it from getting worse, and help you live your life? Treating minor acute illnesses, we do see, scrapes, bumps, and bruises. And then often helping you get the right care from specialty services, because as you move through the stages of your life, often severe illnesses or more complex illnesses do arise, and you need to get care from specialists, and your primary care provider can be a key in helping you make sense of that world. Next slide. So the short answer of what can a primary care do for me? The short answer is a primary care provider is your expert partner to help work with you to help you be your healthiest self. That's what you should look at us as. We know a lot about healthcare, we know a lot about staying healthy, and we work for you. Next. So what is my healthiest self? When I think about it, my definition is of good health is being able to do what I love today, but also being able to do it tomorrow. I know, as Marissa said, you may feel great today, but you want to continue to feel great and do the things you love at every stage of life. However you define what it is you love, our job is to make sure that you're getting what you need to stay healthy enough to do that. Can I still have a regular appointment? So this is the big question during COVID, and the answer is very clearly yes. And there are two major ways that we're providing care now. One, we still see some people in person. We see about half of our primary care visits in person. We just take a lot of precautions. We screen people at the door to make sure we're not letting anybody in who might be infectious. We have everybody wear a mask. Everybody wears a mask. Every patient, every family member, every person who works in our facilities has to be wearing a mask. We still do provide a great deal of care in person. But what we've learned how to do, and I think we do it really well, is to provide what we call telehealth, healthcare at a distance, and we do that over the phone and increasingly via video. And I can tell you from my perspective, many of my patients love this. They love not having to take, 2 hours, an hour off to get there, to wait to get home. They love being able to get the care on their own time, really. And often for me, I'm able to provide more frequent visits with a shorter duration. So I think there actually are advantages to doing video care or audio care. Sometimes you don't need to see sometimes you just need to see the person in person. You need to examine them. You need to check their lungs. You need blood tests. So sometimes people do have to come in. But often we're doing a lot on the phone, and we expect to keep doing that, even hopefully soon when COVID's a thing of the past. We imagine to keep doing telehealth. So I feel fine. Why bother? This is a question that my friends who aren't in healthcare often ask me, I feel fine, why do I need a primary care doctor? Why shouldn't I just wait until I have something that needs to be treated? And really the number one reason is prevention. And I love this little cartoon that I think really says it all. And I think of, as a homeowner, I think about plumbing quite a lot, and I know the damage that a leaky pipe can make. A leaky faucet can destroy, 100-year-old floor, a wall, can do a tremendous amount of damage, and it's a very expensive cleanup process. But if I can do some preventive maintenance and avoid the leak, avoid the damage, then it's often much easier, much cheaper, and much less painful to do it from a prevention perspective. So two definitions. One is emergency care. That's really a short-term plan for an acute problem. That's when, you have a broken bone, you have a throat infection, and you need a short-term care plan of care to take care of something that you're imagining will get better completely. But contrast that to primary care, which is really a long-term plan designed for you based on what you're at risk of for maintaining your optimal health. Next slide. Controlling illness, so that's the first thing I mentioned. It's one of the main things we do in primary care because about half of our patients have a chronic illness. And as we get older, by the time we hit their 60s, it's more like 75% of patients of individuals have a chronic illness, most commonly high blood pressure, but also diabetes, high cholesterol, asthma. These are all very common illnesses that primary care, very common illnesses that primary care manages, but also primary care can help with common psychological conditions, most commonly depression, anxiety disorder, alcohol, substance abuse. These are all things that primary care can help take care of without the need of a specialist. Next. Preventing illness. Always best if you can just nip it in the bud and prevent it. Our biggest priorities for prevention are heart disease, stroke, and cancer. When we think of prevention, we often think cancer comes to mind first, but heart disease is the #1 killer, so we really want to focus on preventing heart disease and stroke as well as cancer. Next slide. So how do we prevent disease? Controlling chronic conditions. Again, if you control your high blood pressure, as you see in that middle picture, you can prevent heart disease and stroke. You may have to take medications that help prevent development of diabetes. And then there's a lot of education that we do to help people adopt a healthier lifestyle. Next. Vaccination is the key way we prevent disease. Flu shots, we're doing that now, and I want to put a lot of plugs in for getting your flu shot. You do not want to get the flu this year. You don't want to get the flu any year, but you especially don't want to get the flu in a year where so many people are getting COVID, and it's hard to tell the difference, and you don't want to be in the emergency room if you can help it. We have vaccinations for pneumonia, tetanus, and a slew of other things that we can prevent through vaccinations. We're very optimistic that in the coming months we'll start to see a COVID-19 vaccination. We do not have it yet, but as soon as we get it, that's something you're going to want to get from your primary care doctor. Next, another way we prevent disease is early detection. We detect disease through blood tests. We detect it through testing, such as at the picture of your colon. In the middle, we do colonoscopies. And then on the right, we do physical examinations. For women, we do the Pap test to prevent cervical cancer. So there are very different ways that we do prevention through early detection. Healthy behaviors, my favorite way, because it doesn't require needles, it doesn't require tests, it doesn't require medicines. Quitting smoking. New York is proud to be able to say that it has reduced the number of people who smoke, and we have a lower smoking rate than the rest of the country, and I hope it continues to go down. That is something that your doctor can help you with. If you smoke, there's probably nothing more important that you can do for your health than quitting smoking, and your doctor can help through counseling, through medication, through programs. Healthy diet is wonderful preventing. We always think of diabetes and heart disease, but cancer can often be prevented through a healthy diet. And then exercise, keeping fit, whatever that means to you, whether it's walking, running, bicycling, whatever it means to you, keeping fit through exercise is critical. How do we prevent disease? Through screening. So what you see here is a timeline. And when we think of primary care prevention, we think of it personalized. A 25-year-old woman has different needs for prevention than a 60-year-old man. So we have, you see a bunch of different tests that we can provide through medical care, through primary care, but it's not one size fits all, right? Smokers, we do lung cancer screening on, but we don't do it for everybody. Next slide. But we also have non-cancer illnesses we prevent, and we don't want to forget about those. Depression, diabetes, hepatitis C. These are all things we can test for, pick them up before they're causing real trouble, and start to treat them. Diabetes treated early can prevent the complications. That's true of all of these illnesses that you see, that if we detect them early and engage in treatment, we can often really nip it in the bud and prevent it from affecting your life in a significant way. The #1 killer in men is heart disease. Heart disease, 1 in 4. Is so by far the leading cause. It's thought that up to 80% of heart attacks are related to preventable conditions, right? So if we detect your high cholesterol, your blood pressure, your diabetes, if we get you to quit smoking, 80% reduces 80% of the risks associated with heart disease. Next slide. It's also the #1 killer in women. We always think of breast cancer for women, and it is a big problem, but heart disease is by far the #1 killer in women. When you add in stroke, 1 in 3 women will die from vascular disease, from heart disease or stroke. Again, up to 80% of this is preventable. That's why it really breaks my heart to see someone who didn't know they had high blood pressure come into our emergency room with a stroke, because often that could have been prevented. Is it worth it? So what's the evidence? I'm a data-driven person. Studies have shown that adults with primary care have 19% lower odds of premature death than those who only see specialists. That is, if you wait until you feel sick and you don't engage in primary care to maintain your health, you have 19%, then you're missing out on reducing your risk by 19%. It's a big change. So how do you find a primary care provider? Lots of folks say, oh, I should always, are saying, yeah, I should get one. I've been meaning to get one. Every year my birthday comes along and I think this is the year I'm going to do it, but I don't. So it's easy. You can do it. I just list the three most common ways. One, just go to your insurance plan. I list the nyc.gov/HBP. This will take you to all the health plans that are provided through the New York City health insurance programs. You click on any of the boxes on the right, and it will take you to the doctor finder, and it will help you find a primary care provider in your area based on what insurance and what you're looking for. I also put a plug-in for where I work, New York City Health and Hospitals, New York City's own healthcare system. We provide primary care, and we're really proud of the primary care that we provide, and we're throughout New York City. Call 818-444-NYC-4NYC or go onto our website to find a primary care provider. But honestly, the best way to find a good primary care provider is to talk to your friends. If your friends tell you, oh, I've got this primary care provider that I love and I couldn't live without him, that's who you go to. So as a primary care provider myself, all my friends will ask me. I don't see them myself, but I'm happy to recommend people to them. So definitely, if you don't know where to go, one of these 3 areas, one of these 3 directions it will help you get primary care. So what will it cost me? Really good news here. The city offers several plans with no yearly premium, right? So if you're a full-time employee of the city, you can pick health insurance that has no out-of-pocket costs at all. If you do have one of those, such as Emblem, that does have some out-of-pocket, some premium, you can still get primary care for no additional cost by picking a preferred provider. And we just put up the top 3 insurance plans: Emblem GHI, Emblem HIP, and MetroPlus Gold. And you can see the copays are really very small. And if you go for someone in network or preferred provider, then there may be no charge at all. And by going to the website that I just showed you, they will lead you to who's in network. But even if they're out of network, it's still worth doing. A preferred provider or participating provider, these are just folks that have agreed to work with the insurance company a little bit closer in terms of making sure that they're meeting certain standards, and in turn, the insurance company prefers them, lowers your cost for them, and is happy to send you to them. If you're MetroPlus Gold, anybody in the network is free to you. I also want to add, sorry, before we move on, that under the Affordable Care Act, all recommended screenings are no charge, and recommended screenings are ones that the national guidelines groups have advised as things that everybody should get. These are things like mammograms and colon cancer testing and vaccines, and these are no charge according to the Affordable Care Act. So when can I go? Well, city employees are actually permitted to use their sick time for medical appointments. If you're like me and a bit of a workaholic, you don't take a lot of sick time, you should, if for nothing else, then just to make medical appointments. And you can also, if you're taking a loved one of your dependents, you can also take sick time for that. So it's a benefit of working for the city. Go ahead and use it. City employees can also take up to 4 hours per year for cancer screening, mammogram, colonoscopy, GYN, PAP, and on timesheets. On my timesheet, at least, there's a little code that I put in if I'm going to get my colonoscopy, so I don't have to take either sick time or annual leave. I just put it down that that's when I'm going for my screening. You should contact HR or your personnel representative just to clarify how this works at your agency. So that's it. What I've gone over, I hope, is who primary care providers are, how you should use them, what you can benefit from them, how to get them, and what it costs. But I'm really happy to take time for questions at this point.
Thank you so much, Dr. Stevens, for that great overview. And for the folks that are on the line, I invite you to type your questions in to the question and answer box, and we'll address them as they come in. In the meantime, there were a few things I just wanted to kind of reiterate, which is that we can't stress enough what a great resource telehealth is. The 3 plans that Dr. Stevens mentioned, the Emblem GHI, the Emblem HIP, and Metro Plus Gold. Those are all plans that have no yearly premiums, very low copays, and they all offer telehealth right now and likely beyond. So if you have Emblem, Teladoc is your provider. If you have Metro Plus, they have their own kind of virtual visit platform. But like Dr. Stevens said, the website nyc.gov/HBP for Health Benefits Program is where you can find all of that information. And one question that I did want to ask you, Dr. Stevens, is what to do. COVID is in our communities right now. Hopefully it won't get much worse, but I think we're all aware of that. When do you call your primary care provider if you think you have COVID, or what steps should someone take if they're concerned about that?
Thanks. That's a great question. And we're really, both during the surge and even after, really trying to keep people out of the emergency room for milder cases of COVID. We're still not doing much more than supportive care, meaning fluids and rest, and Tylenol for milder cases of COVID. You should, if you develop, but you should always call your primary care provider. It's good to have somebody know that, to work with, so that they can tell you, here's what to worry about, here's when to call me if it gets worse, here's to go to the emergency room. Generally, what I recommend to my patients is come to the emergency room. Don't wait to call me. Just go ahead to the emergency room if you're having trouble breathing, if you're feeling so sick that just doing the basics to take care of yourself are becoming difficult. If, however, it just feels like the flu, where you're coughing, a low-grade fever, then drink lots and lots of fluids, Tylenol, especially to bring down the fever and control the body aches, and isolate. Stay away from as many people as you can. But setting up a televisit with your PCP, if you think you've got COVID, that's a good idea.
Great, thank you. Another question that came in is, people who might have a primary care provider and always have the experience that they're being rushed. I'm sure you can attest to the fact that doctors' time is tight, but as someone who's looking for that partner and that personalized attention, how would you handle that?
Yeah, that's a terrific question. And, you know, I want to think that I never am rushed, but I know there are busy days where there's a lot of complex patients, and I probably give that impression sometimes of rushing as well. And I hate to think about that, but I think there are things that you can do to make sure you're getting what you need. And I think preparation is really helpful. And do your homework. And those are two different things. So one is think about, you know, what do you need to get out of the visit? What's most important to you? Sometimes people will come in to the office and they'll think of something in the waiting room, and we'll end up spending 10 minutes on that, and they won't remember the most important thing until they're walking out the door. So, you know, I encourage my patients to come in with a list. Think about, when you make the appointment, think about what was your priority for making that appointment. Write it down and say, this is the most important thing I need. And when you start the appointment, show the list to your primary care provider or any other healthcare provider that you say that this is what's most important to me. And then maybe if you don't get down to the 7th or 8th most important thing on your list, that's okay, as long as you've taken care of the most important things for you. On the other hand, I think it's also fair to say to your doctor or to your healthcare provider, what do you think is the most important thing for me as your patient? Because I think sometimes also, you know, we may get sidetracked with something that is a lower priority. So I think setting up an agenda right at the beginning and say, here's how we want to use the time that we have, and if we run out, we can make another appointment. But at least we know that the time we have will set up to succeed in meeting the most important questions. But that agenda setting is critical. I teach a lot of doctors, and I always teach them, it's one of the first things I teach them is before you start in, make sure you know what the patient wants and the patient knows what you want from that visit so that you use your time well. I hope that helps.
Yeah, that's great. It's a great reminder that, you know, for that partnership, both parties have to kind of know what they're coming to the table to talk about. Yeah, and I'll say that Workwell NYC, one of the tools that we have available is kind of an appointment checklist to kind of help get you prepared for a primary care visit, and I'll share information on how participants can access that later. And
yeah, I want to put a plug in for that checklist. I think that's really great. Anything you can do so that you come in prepared.
Yeah, I'll say one thing that works for me, or I've done previously, is I use my phone and I use the Notes app. So a lot of times, there have been many times in my life where I've like left a doctor's office and the next day thought of a question for them. So now I will like jot them down on my phone, you know, when I'm on the go, which isn't that much anymore, so that I always have a place of notes. And I also find that just writing it down or typing it out helps it stick in my mind too.
Yeah, even in the waiting room, on the back of your appointment slip, just write out a couple of questions to make sure when you walk in, you know what's important.
Yeah, very great. And I think it's all about partnership, right? I think you talked about the primary care doctor being a partner, but I think, you know, folks should come to the table with their concerns and their needs too. And I think, you know, it'll make for a better relationship for all. I want to get to some other questions that we have. One is diabetes screening. Is that considered a preventative test under the guidelines you discussed?
Yeah, it's a little controversial because it's you know, nationally the evidence has not been persuasive enough. Having said that, increasingly doctors are starting to screen for diabetes as part of routine care. I do it in my practice. We do it in my system. It's certainly something that if I were getting primary care, I would ask for.
Okay. And I know we, at Workwell NYC, we're commemorating Diabetes Awareness Month. So I don't know if there's anything else that you might want to add about diabetes prevention or anything that's important for folks to know there.
Yeah, I mean, I think sure, no, thank you. So the primary reason we screen for diabetes is to find it early, but the most powerful prevention for slowing down diabetes once we catch it early is actually lifestyle, diet and exercise and moderate weight loss. Even like a 5 to 10 pound weight loss can really slow down progression of early diabetes, or what we call pre-diabetes. So even if you don't get screened, we're all at risk for diabetes. Everyone's at risk for diabetes, whatever your blood test says. So maintaining a healthy weight, exercising, and eating right are all very powerful.
That's a great segue, because I also wanted to ask about, I know you mentioned that primary care doctors are an important kind of partner in helping with healthy behavior. I think a lot of us know we should exercise, we know what to eat, you know, that we should quit smoking. How can a primary care provider play a role in helping you achieve those behaviors?
Yeah, in a few different ways. One, a primary care doctor can help you understand what your specific risks are and where diet and exercise might fit into that, and that can be very powerful, right? You may not have known, you know, you have a family history of a certain condition, but you might not have known that diet and exercise can help you reduce that risk. So that's one, is helping you understand the need for it. What I do a lot with my patients is sitting with them and helping them pick a place to start, because nobody goes from 0 to 100 in terms of improving their diet and their exercise overnight. But I will sit with my patients and say, all right, where do you want to start? Just pick one thing. It could be, getting off the subway 2 stops early and walking that last bit. So that's something that a primary care doctor can help you with. And if you do have measurable risk factors, such as mild elevation in your blood pressure or your blood sugar, your primary care doctor can help you see if those are getting better as you change your lifestyle.
Yeah, that's great. Thank you. Another question that came in is about people who might have friends or family who are afraid to see the doctor because they're afraid of getting bad news, which I understand that is really scary. How would you kind of address someone who's coming from that place?
Yeah, I mean, that is an unfortunate fact of life, and sometimes that does happen. 2 things. One, often the bad news is less bad when you catch it early. Whatever the condition is, it's almost always better to catch it early. The second thing I would suggest, well, if you've got a family member who's nagging you to go get medical care, I would ask that family member if they would come with you. I think it's a much less anxiety-producing experience if you've got somebody you care about and who cares about you sitting next to you, helping you ask the hard questions, helping you understand the messages, and just helping you get through the anxiety of the experience.
Yeah. And actually, another presenter we worked with on a different webinar gave a great suggestion, which is during COVID times, you might not be able to bring someone, but have someone on speakerphone, if that's okay with the doctor, someone who
Absolutely.
can hear the information with you, and it can also help retain the information. I saw someone put a comment in the chat about bringing pen and paper to your doctor's appointments to write things down, or writing out your questions, leaving room for answers. I think that's great, because I think we've all been there where we're in the moment and we're trying to listen, but there's so much information coming our way that you might leave and be like, did he say that, or did he say that? So
and you can and you can also dial in a third person on in a televisit. And what my patients often do, especially my older patients, they'll just go ahead and call the family member and put it on speakerphone, and they'll kind of be in the room virtually. So any way you can bring another person that is caring about you into the healthcare, that's always a good thing.
Definitely. So the more partners in the process, the better. And I was thinking about that actually when you mentioned about asking friends and family for their recommendations for doctors. I think that's also a way to start a conversation, to say, Mom, Dad, brother, do you have a primary care provider? If so, can I see them also? But if you don't, I really think you should, and this is why. So I think, for us all to do this together, I think is a really important part of the journey. And I do just want to respond to one question that came up about the 4 hours of time off for screening. It is for men and women. Obviously, if it's a cancer that is, only for one gender, that's a different story, but the screening time is available to all employees. It is regulated through DCAS, and, like Dr. Stevens said, if you have any questions about how you do that, using it, your HR person will be the person to go to for your agency-specific details there. I got a couple of questions come in about the COVID vaccine and if it's going to be safe and when. And I know, you said to me the other day, I only know as much as coming out in the news. And I totally understand that because I know it's moving so quickly. But do you have any general guidance you could give to folks?
Yeah, it's a new kind of vaccine, which is good because the way it works, it's a tricky vaccine. And sorry, let me just silence this. It's a tricky virus, and so we need a tricky vaccine for it. Having said that, it's not a live virus, so we're not in the past, especially we used live viruses that have been killed, but the whole virus, and we inject that, and sometimes that could cause symptoms. This is just a particle from a virus, so it doesn't have the chance of causing COVID. Having said that, it's a new therapeutic. It's something that we haven't we don't have the experience of thousands and thousands of people like we do with every other vaccine. So I'm watching the FDA. I trust the FDA, and if the FDA says it's safe, they never just say it's safe. The FDA always puts out, or the CDC, they put out a fact sheet. Always, they put out a fact sheet, and it always says, here's what it does, here are the side effects. And so, I would follow the FDA, the CDC for information, the State Health Department. These are places that I go to for trustworthy information. But it's new, right? And it's not out there yet. So when my patients ask me, should I get the vaccine, I say, wait a few weeks. Let's wait for more information to come out. But I can tell you, as soon as I'm convinced it's safe, as soon as it's available for me, I will get it. This is a disease that people die from. And if we can prevent it through one shot or however many shots, then we should. So I'm not, I encourage, to me, I go to the New York Times website to read about the breaking news on what the virus is and how it works. But then when it's time to use it, I'm going to go back to the CDC and the State Health Department to know whether it's something that I can be confident in.
Great. Yeah. Thank you. And I also just wanted to pick your brain on vaccines in general, because I know there's a lot of information out there about vaccines that might not always be correct. And I'm just wondering, when patients come to you and they're confused maybe about which vaccines, like what do you generally recommend when it comes to vaccination? Yeah,
so I mean, there's, again, I'm going to go back to the CDC. The CDC is really our national expert body for what vaccines are right at what age. And if you go to the CDC, or there's a branch of the CDC called the ACIP, the something Committee on Immunization. I'm not good at remembering what things stand for, but the ACIP is where I go. And there's not really that much controversy. Right? It's pretty clear, the adult vaccines, tetanus, pneumonia, if you're over 65 or have diabetes, herpes zoster or shingles is another vaccine that's age-based. But it's not endless, and the vaccines we use are all very much tried and true, and so On the adult side, I don't think there's that much controversy, but you can, anybody knows you can find anything you want on the internet, right? You can find them, to say that the masks we use to protect against COVID will kill us, right? So there's a lot of misinformation out there. Go to reputable sources. The CDC is still very reputable, and WebMD, which is a private company, but I'm not involved in them. But my daughter has been using them for years, and they give pretty good explanations of things. But there's some reputable resources. The State Department of Health and the City Department of Health are very reputable. It's also another thing to talk to your primary care provider about if you want more information about something. Get as much information you have, but just be careful about where you get the information.
Actually, a good question after that is, so say you have a question like about the COVID vaccine or a vaccine in general, and you just want to ask your doctor. I know a lot of doctors and health facilities now have things like MyChart or ways you can kind of shoot a quick note to your doctor. Do you have any guidance on when to use that feature versus, scheduling a face-to-face appointment?
Yeah, I think for specific questions, if there's a way to get a question to your PCP's office, depending on the practice. Like I have nurses in my office who can answer straightforward questions, and they're very knowledgeable about vaccines and preventive care. And I don't, they can usually give you an answer in a couple of hours rather than waiting for an appointment. So I think it's going to depend. You mentioned MyChart. MyChart is a portal which increasingly primary care practices have. MyChart is a specific portal for a system called Epic, but there are a bunch of others. And they're a way to send a question through electronically to your PCP's office. But I think, when picking a PCP, that is something that I would think about. And, if your friend says, oh, go to my doctor, he's great, ask, well, if you have a question, how do you get the question answered? Because if I want to know if I should get the shingles vaccine, I don't want to make an appointment just for that. That seems like a little bit waste of my time and the PCP's time. But if I can shoot a question over via email, or they have a phone line that I can leave a question for, that's great.
Yeah, I think that lots of technology, especially in the last few months, kind of innovating and helping kind of connect people with their providers in different ways. I know we've been asking a lot of questions, but there are a lot of them coming in. I'll just give a couple more. One person asked about stress, the stress of the pandemic, the stress just of 2020 and many other things, kind of on top of managing a healthy lifestyle. And the question was about if doctors are noticing whether this is impacting our overall health. I think we can all say it impacts our overall health. But I just wanted to pose the question to you about stress and how that affects, disease and risk and any tips you have there.
So I think it's fair to say that stress makes everything worse. There's the mind-body connection, that good evidence that shows that severe stress does increase the risk of illness. But even mild stress often it decreases our ability to take care of ourselves. So we're stressed, so we stress eat. And we don't tend to stress eat celery and carrots, right? We grab the stuff that makes us feel good in kind of more fundamental ways. We skip our daily habits of taking care of ourselves. We don't connect with family and friends as much. We don't pursue our hobbies. We don't exercise. So stress to me is the flip side of stress is taking care of yourself. The flip side of stress to me isn't no stress. None of us are lucky enough to have no stress. The flip side of stress is taking care of yourself. And when you don't take care of yourself, your risk of illness goes up. And we often see people who've had well-controlled chronic illnesses, when stressful life situations happen, they stop taking their medicines, they stop coming to get care. So there's a lot, that stress is everywhere in terms of your health.
Yeah. So I think the advice there is try the best you can to manage your stress, and it will help all aspects of your health and your life. I know it's often easier said than done.
And honestly, what sometimes I tell my patients is the first thing is just recognize that you're stressed. Just name it and say, I'm feeling really stressed right now. And that often gives you some permission to take a break, take some deep breaths, go for a walk. But just recognizing it is a huge step in managing your stress.
Definitely, and I will make a plug for our Work Well NYC digital class schedule. We have meditation and mindfulness and a yoga and a range of physical fitness classes as well that are ways that I know help me reduce stress many times. Thank you so much, Dr. Stevens. I'm going to just wrap up with a little more information about some of the resources we have available. I do want to say I saw some questions in the chat about insurance coverage over specific benefits, and I just want to say sometimes it can get tricky if your doctor requests something and the insurance company doesn't approve it on the first try. Say your doctor in the doctor's office is there, they can help kind of justify, but I just recommend, reaching out to your insurance company and saying, hey, why is this going on? And kind of, I know sometimes it can be tedious to work with, back and forth with the insurance providers, but we want to make sure that people get the coverage for the care that they need. But just to move on, I know I mentioned earlier on, we have a primary care appointment checklist, and we have a few different resources that are tips to help you kind of find the primary care provider that we've been talking about today, someone who is your true partner in care. We will share these in a follow-up email, but also if you're jonesing and you want to look for them today, you can visit nyc.gov/takeaction and find some of those resources. Next slide. And can't say it enough. I know Dr. Stevens said it. I just want to reiterate. The flu shot is so important this year. Actually, when we prepared these slides, it was 1.2 million New Yorkers I saw today. It's up to over 1.5 million New Yorkers have gotten their flu shot so far. It is so important, like Dr. Stevens said. You don't want to be sick this year. You don't want to have to go to the ER or even a doctor's office. The flu shot is safe, and we really encourage everyone to get it. Everyone who is eligible for New York City health benefits, employees, dependents, pre-Medicare retirees can get a free flu shot at no cost at a participating doctor's office, at a pharmacy, and we really recommend that if you haven't taken that step yet, that you do it soon. And I know we talked a little bit about COVID, given the cases ticking up. Getting tested regularly is a really important tool for all of us in helping to stop the spread. COVID testing is available to employees at no cost. And if you visit nyc.gov/COVID test or you text COVID test to the number on the screen, you can find a free testing site near you, and they are all over the city. So, just another tool in our toolbox for staying healthy this winter. And lastly, I know we talked a little bit about stress, and 2020 has been a really challenging year. And at Work Well NYC, we really believe in the power of art and expression to heal, and we are encouraging all artists, whether you're a poet or a dancer or a photographer, to kind of submit work reflecting on 2020 and what it has taught you, and how you've coped with it. And so submissions are being accepted through November 27th. We'll send out follow-up information on this as well, but please visit the website if you're interested, and we welcome your creativity. Next slide. Lastly, we have a brand new kind of challenge to end the year. It's called our Renew Year Challenge. It is a mind-body challenge that will help you kind of close the year on a high note. I know we just talked about 2020 being difficult. This is a challenge that has a step goal that you can reach every day, as well as daily activities to kind of help you reflect with gratitude and focus on mindfulness and look forward to the future. The challenge begins on December 7th, and registration is open now. We will send out more information as well. And that, next slide. And lastly, thank you all for joining today. Thank you again, Dr. Stevens, for your expertise and your insight in all of the questions and information you shared. And we just encourage you all to stay connected with WorkWell NYC. There are many ways you can reach us. We welcome your feedback, your questions, and we look forward to continuing to offer programming to help you take care of yourself and be your best self. And so thank you all very much again. Thank you, Dr. Stevens. And I hope everyone has a safe and good day. Thank you.
Thank you.